You got your penile implant surgery and you are nervous about what's waiting for you for next 6 months. This video is just for you. Hello everyone, this is Dr. Yaşar Pasha. I am a consultant andrologist in Istanbul. We are one of the highest volume center for penile implant surgery, especially in the European region. Today I would like to talk about the process after the penile implant surgery, especially in the first 6 months of surgery. As you all know, penile implants are the most effective treatment for severe erectile dysfunction. This is a revolutionary treatment for the erectile dysfunction. If you don't get benefit from other treatment modalities, we go with the penile implant surgery. But patients, of course, has some concerns about surgery and the process after the penile implant surgery. In scientific publications, we all know that the satisfaction rates after penile implant surgery rise up to 98% after 6 months of surgery. But in first 6 months of surgery, patients have some concerns and doubts about surgery, and they have some regrets after the surgery because of getting the implant surgery. Let's look how can we prevent these regrets after the penile implant surgery. First of all, you have to know that you have a new penis and you have a new appearance and have a new sensation, and which is successful to have a sexual intercourse. After several years with erectile dysfunction, you lose some length of penis, you lose your power, you lose your rigidity, you lose your power, and now with the implant surgery you will get them back. But in first 6 months of surgery you have some problems with the surgical method or surgical treatment. Of course, in the first 6 months you may have some pain during sexual intercourse or during resting time. All of these are acceptable. If you have severe pain after implant surgery, there may be some problems, but we don't expect to have much big pains after surgery. Generally, the pain after surgical treatment resolves in first 2 weeks of surgery. If you have pain after 2 weeks of surgery and which is severe, you have to check your implant and if there is infection or if any other problem. And the other important point is doing cycling after the surgical treatment. First of all, I advise my patients to feel the pump after the surgery. If you feel the pump first, where is the deflation button, where is the pump, where is the cables, how it's located, is really very important. Usually we place the pump and the deflation button facing forward of the scrotal pouch, but sometimes it can rotate into the scrotum because there is a capsule formation, surgical capsule after the surgical treatment, and capsule can rotate your pump. First of all, I advise my patients and the others to feel the pump and feel the deflation button, and after several weeks of surgery, depending up to your surgical technique and the surgeon, you will start to do cycling of the implant. Cycling of the implant has a crucial role to have a maximized length and girth after the implant surgery. As I mentioned, there is the capsular formation. To break the capsule, we do cycling after the surgical treatment. Especially after my techniques, especially after infrapubic technique, I start cycling after 3 weeks of surgery, but for some cases 4 to 5 weeks of surgery, we start cycling the implant, because doing cycling with the implant, you will feel your pump better, you will feel the sensation. Of course, during cycling you will have some pain because you are stretching the tissues which had surgery several weeks ago and you are trying to stretch them. It causes some pain, just like doing physiotherapy after orthopedic surgery, and this is completely normal to have a pain after using the pump in first cycling methods. After cycling, you will get used to your pump and you will understand how to use the pump and how to inflate the device and how to deflate the device. I advise all of my patients to do cycling, especially twice daily for the first 6 months of surgery. Even you don't get sexual intercourse, just cycle your implant, because by doing cycling you will get maximized length and maximized girth with the surgery. Don't inflate the device forever, because if you keep your device always inflated, the surgical capsule will form in the reservoir of the implant and you may have some problems when deflating the device. Just inflate the device half an hour, 2 times in a day. If there is very hard tissue around your pump and scrotum, you may have some warm bath, not too hot water, but you may have some warm bath to lose your tissue around the pump and you can solve your sticky pump. And don't forget that by using the pump, it will get soft in a while. In the first part, the silicone is a hard silicone. By using the implant, by using the pump, it will get softer in a while. Please do not get confused and stressed with the implant. In a time, you will get used the implant properly. You will have fun. You will have your partner will have fun with the implant surgery. If you have concerns after the implant surgery, if you have problems with your implant, you can contact my team and learn much more about the implant surgery and the problems related with the implant.